And breathe it all out. Good. Awesome. Breathe it all out. Good. Good. One more. Good. One more. All right, on this side. Awesome. All right.
Yeah, I think we need to do like once a week introduction videos for Angie. That should be a good plan. Hey everybody, Dr. Warren Kelstein here with our new chiropractor on the team, Dr. Angie Darkus, and you are joining us. This is your second full week here.
Yeah.
So excited to have you. We're gonna do a little introduction to her as well as to something that I'm doing over the next 4 weeks. I have a triathlon coming up. I've never done a triathlon. I think Carly just kind of, or maybe you said that, you're doing like couch to 5K. I'm doing couch to triathlon a little bit. I'm active. But these next 4 weeks will be pretty important for me as I ramp up training.
Absolutely.
And Angie, Dr. Angie will be really helpful for me as well. Thank you, Angie. I just signed you up for that. I appreciate you.
Let's get it rolling.
Yeah, we're going to be doing some work in here with shockwave, with dry needling, with light therapy and adjustments, and I'm going to get in some body work along the course as well as massage. I'm just fortunate. I say all this time, I'm like, damn, I'm lucky. I got access to a lot of really good healthcare, but I want to share the experience with you. So one, I can do our best to educate you on recovery and conservative pain management, as well as wellness and function on that journey. And then in the process, I just show you kind of my training schedule that I'm working on right now. So,
awesome.
Cool. Hey, so how'd you find us?
Well, actually, someone found me on LinkedIn.
I did, and I'm so grateful that I reached
You're
out.
like, hey, we just happen to be looking for someone, part-time or full-time. Hope you're interested.
And that worked. Instead of sitting around waiting.
I mean, yeah.
Thank goodness. And it just worked out kind of in a great way. So tell me a little about your journey. How'd you get to chiropractic school?
So I always knew I wanted to work with people, loved working with athletes. Starting in high school, I worked with an athletic trainer. Already getting stuff moving. We like it.
We like it.
So then from there, he was like, don't major in it. We don't get paid enough for what we do. And I said, absolutely. All right. Thought I was going to pivot towards PT. And in my undergrad degree, I had to do 1,000 hours of internship. And I studied under a chiropractor for a portion of that. And he taught me all about chiropractic, what it means, what they do, how they help people. And I was like, wow, that actually really aligns with how I want to help people and how I want to be preventative and proactive, help athletes and help people just function in life better.
Mm-hmm.
And yeah, started applying to chiropractic schools, and here I am.
So in the beginning of this video, I had some things I wanted to say, and then I forgot to say them. And then that quickly, Andy just reminded me of what I wanted to say just because in this moment. I mean, what a wonderful person that's joining our team. Just such good values, such a strong work ethic, and good with her hands. Really good with her hands, good touch. The first time she came in and in the process of interviewing, I just had her work on me. And I was like, oh, she just totally, you could just feel how people are comfortable and modify touch, pressure, and movement, and get a sense of things relative to the adjustment. And she's got that. She knocks that out of the park. But on the back end of that, you can't always pick the person, right? And we just got so lucky with the person. So shout out to Angie.
Thanks.
Yeah. Thanks for reminding me.
No problem. Glad I could be the person.
So wait, you shadowed this mentor, this chiropractor, and you're like, wait a minute, this is kind of. I didn't know this is what I wanted to do, but this is kind of lining up with what I wanted to do. You played volleyball, right?
Yes, I played volleyball in college. I played at Norfolk State, so Division I, and he was our chiropractor at our school as well as one of our department professors.
Right on.
Go ahead and take a breath in and breathe it all out. Good. Awesome. One more time, breath in and breathe it all out.
So he was an educator and a mentor,
Absolutely.
And he was working on you relative to the athletes.
Say that again?
He was helping the athletes. He was working with the
athletes.
Yeah.
So what started it was we had to run a mile in under 8 minutes or something, and I would run and I would start feeling this hip pain, and I was like, maybe it's my shoes, and I changed shoes, and it still kept happening. And I went and talked to him, and he was like, well, let me check your hips. And he looks at my leg length and he was like, well, it looks like your right leg is shorter than the left, but it's because of your back. Do you have a lot of back tightness? I'm like, yeah. Everything's one-sided the way I've been hitting and everything with volleyball. Mm-hmm. So he worked on me, and immediately, it was like next day I went running and cruised. I did my 7:30 mile, and I was like, perfect. Like, this is great.
You were feeling good.
And oh yeah, I felt like I was quicker. I felt like I had more like just body connection. Go ahead and lay on your side facing me.
Sure thing.
And yeah, I was like, wow, this really worked. And when I was interning with him during my hours, I had shoulder surgery after my senior year, and I was having pain. I tried PT, worked with the athletic trainer for many months, and ended up having surgery, and it helped a lot. But I went to him when I was doing my rehab, and that was where I had a lot of relief, got full range of motion. Breath in, breathe it all out. Good. Good, one more. And to the other side for me.
So you rehabbed, you said your shoulder? Mm-hmm. No. Was it a rotator or a labrum for your shoulder?
So I just had really loose capsule. I'm hypermobile a little bit, but they were like, we're surprised you haven't dislocated your shoulder. I'm like, yeah, I'm glad I haven't. But so they just tightened the capsule, and it was supposed to be a thermal shrinking, was what they told me, kind of like shrink wrap it. But when they went in, they were like, it's really loose, so they had to pleat it and stitch it.
Got it.
So yeah, went through that, did the whole rehab process, and would do like some of the modalities some of the ones we have here, but not all the fancy ones. Breath in and breathe it all out. Good. Nice. And flat on your back.
Oh, that's lovely. Thank you.
You're welcome.
All right, so you've got this great experience from an education standpoint as well as a therapy standpoint, so you're leaning that way. Where'd you go to chiropractic school?
I went to Palmer College of Chiropractic in Florida.
Florida.
Yeah.
Was Florida calling your name, or was Palmer?
More so Palmer was calling my name than it was Florida. I liked the fact that the school size itself, I felt like I had a bit more of an intimate, like, teacher to student ratio.
Sure.
And just like the mindset that they had, and just their philosophy, and how it was very integrated in chiropractic and rehab and physical therapy side. It was kind of like all encompassing, it felt like. So nice. I liked that.
Was it what city in Florida is Palmer?
Port Orange.
Port Orange.
So just south of Daytona Beach. So we were about Central PA. Or Central PA. Sorry, Central Florida.
No, you're good. You're thinking about Central PA right now.
There's a lot going on up there.
Yeah, there is.
It's like lots of wedding planning up there now.
Come on.
Yeah.
Angie recently got engaged recently?
Yes, back in December, and we're planning our wedding for spring of next year. And we just, honestly, today officially decided on our date and our venue, so it was exciting.
Nice. Congratulations again.
Thank you. Mm-hmm. All right, little adjustment here. We're gonna wrap this up. Good. Wonderful. Higher on the side. Awesome. Good. All right.
Yeah, I think we need to do like once a week introduction videos for Angie. That should be a good plan.
It's like I got a lot of stories. I can talk a lot. Oh, good. You said it was your right hip that gives you issues?
Yeah, you got it.
Good.
Yeah, we can talk about my hip next time a little bit.
Okay.
Talk about how we treat labral tears and tendinopathies, which I got going on in there.
Was that from lacrosse?
Life.
Okay.
But probably a lot of lacrosse too. Yeah, definitely.
All right. We coming up?
We're coming up.
Okay.
I feel great. Thank you so much.
You're welcome.
Awesome. So we'll jump back in. All right. We got a lot more questions to ask.
Yeah.
All right. How about this? What questions do you have for Dr. Angie? Put them in the comments below. We'll do follow-up videos if we get those questions. Hey everybody, this is Dr. Warren with Dr. Angie and Roman. We are here this morning in Towson, and I'm just going to be talking for Angie because she is going to focus on dry needling Roman's first metatarsal joint, and so proximal joint. But something you might have heard of before, if you deal with a lot of foot pain, you might have looked this up on your own, turf toe. You've got an acute flare-up of turf toe, and I'm just going to be kind of giving a little demonstration with the laser and a little bit here as well in terms of what we use. So we're dry needling the capsule, pretty intense kind of for just a quick moment, and then he's able to let go for through the rest of the treatment. Roman, I love getting to work with Roman when he does come in from just helping him out, but also the fact that culturally, he's just got a lot of really unique experiences in his life, as well as what he does for a living and where he's going. So he's a big fan of Florianópolis, Brazil, which is something I kind of always wanted to go check out. So shout out to people that live in Florianópolis and that area. Roman, you got to meet somebody today that came over and helped out your house.
Yeah, I have a funny story because I had a Comcast guy show up to take a look at some wiring, and then, you know, we were chatting for 15 minutes, and right as we were saying goodbye, he looked at me and he said, "Do you go to Kalkstein Chiropractic?" And I said, I do. And I thought he was another patient here, but he had actually found you through your videos online and had seen another video where you adjust my spine and had actually remembered. I guess he said he recognized my
You're
voice.
a star,
Yeah.
huh?
I felt like a minor celebrity in the world of chiropractic.
Let's go. Good stuff. So I'll let you guys go ahead and watch Dr. Angie dry needling. She's doing a wonderful job over there.
She is.
Angie's got good touch, good hands, and she's doing a pretty intense setup, but you can tell how kind of patiently she's setting the needles, and Roman was able to talk through all that, which I don't know how he did that, but I'll let you guys kind of jump in there. And Roman, it's good seeing you. Hope you feel better, all right?
Yes, thank you so much. I really appreciate the care.
For sure.
So I'm going to get a little bit underneath it as well,
Okay.
Yeah, a little jump there. A little tender spot. Good. You're doing so great.
Thank you. I feel
Look a little
it's
bit
the
like a
most-
Frankenstein toe.
Yeah, it's a little bit the most intense dry needling I've gotten ever, so.
Yeah, so with turf toe, it's the tendons around the toe. It lifts it as well as what helped to like lift the toe, as well as why it hurts to kind of roll, like point down, or if you were to try to curl your toes. So I kind of wanted to get around it, which is what we did. We kind of went from the medial side all the way around. I always try to start at the point of least tenderness, just so it's not to alarm the body a little. But we're gonna let this sit here for about 10 minutes and let your body just kind of do what it needs to. Let it relax with the needles. I'm actually gonna get one more right in here.
Yep.
When we think about the tendons and how they come up the foot, we want to address like how they pull.
Oh,
So,
yeah, that's a good spot.
Yeah. Sorry.
Oh.
There we go.
There we
Awesome.
go. That was
Just that
intense.
one
Thank
little
you. That
one
was
there.
good, yeah.
Okay. We'll leave you here for about 10, okay?
Yeah, it hurts for a sec, but then it actually releases a lot.
Exactly. That one little like inch of pain, but then we subside.
Yeah.
All right, hi everyone, it's Dr. Angie here at Kalkstein Chiropractic. I have Sophia here. Sophia is the lovely face we see when we first walk in the door. So we're gonna do an intro video with her while I adjust her. I'm gonna ask her some questions so you can get to know her. All right, so Sophia, how long have you been here at Kalkstein Chiropractic?
It is going on 3 months. I started in January.
Okay, awesome. Have you been loving it?
I do. I love it. It's good. People are great.
They are great. All right, so as far as chiropractic wise, you've been adjusted before. You
I have, in the
started
past.
with car accident. Was that what started you with chiropractic?
Yes.
Okay. And then afterwards you're like, hey, this stuff it does some good things for me.
Yes, definitely makes my back feel much better.
Good. All right. Are we feeling anything today that we want to work on?
Typically my lower back.
Lower back from standing all day kind of thing, or is it just the
Standing,
up and
bending
down?
over.
Gotcha.
Yeah, typically from
All right,
bending
let's
over.
take a look. Let me have you step up onto the platform. You got your armrest there. Have you lay face down for me. Taking the nice ride down. Cool.
Doo-doo.
All right, so tell me a little bit about you. Prior to starting here in January, what were we doing?
I am a barber
That's awesome.
by
Okay.
career.
A barberer. How long have we been a barber?
Over 13 years.
That's awesome. What got you into that? Was it just something you enjoyed?
I originally liked doing hair, women's, and then I realized men is easier.
I believe that. A lot less maintenance, a lot less complication with it, for sure.
Yeah, and the turnover, in, out, kind of.
That's true. I feel like whenever I get my hair done, I got a lot of it, and it's all very curly. It takes me like 8 hours in the chair if I want to get my hair done. And
Yeah.
that's a long day for me and for my hairstylist, so I get that.
Yup.
Gotcha. All right. And then have you always been in this area or been in Baltimore?
Yes, born and raised.
Born and raised? Awesome. Different parts of like throughout the city or in the county or?
Started in the city and moved to the county.
Nice. Okay. We're going to do a little lift and twist here with the lower back. Good. Good. All right, we're going to do that same thing on the other side. What's the most you miss about the city?
Actually, nothing.
You're like, county's pretty nice.
Yeah, nope, I like the county.
Yeah, it's a bit quieter.
I thought that.
You can still go to the city though. That's the great thing.
Exactly.
You can still go and have a whole day and then come home and be like out of it.
Enjoy it and be out of it. I thought I liked the city life, and then I'm like, no, I hate when there's no parking. I hate traffic. I'm like, keep me in the county.
Yep. I got that. All right, go ahead and take a breath in here for me and breathe it all out. Good. One more, a little bit higher breath in again and breathe it all out. Good. All right. I'm going to have you lay on your side facing me.
Makeup in the chair.
That's why the face paper's there. I'm going to bend that top leg. Perfect. And then you're going to hold the opposite arm. Good. Everybody kind of rock and twist with me. Breath in and breathe it out. Good. Good. Nice. And to the other side. Right. Bend in that top leg. I'll tuck that arm. Perfect. Good. All right. And then what about family?
What about it?
Who's here? Who we got with it? Well, not with us here, but like, you know what I mean.
My whole family.
Whole family's here?
Yeah.
Nice.
Whole shebang. I got 2 kids.
Nice. Breath in for me. And breathe it all out. Good. Nice. And flat on your back. Ages?
It just fell off the table. 12 and 2. Well,
12 and
13
2?
and almost 3 next month.
Wow. Okay. I was gonna say, how does the 13-year-old like that age gap?
She'll be 13 in July, but actually she likes it. She wanted a sibling, so
Oh, nice.
she got a sibling. And she helps a lot. She's great.
Oh, that's wonderful. I was gonna say, is the soon-to-be 3-year-old, is she like, or trying to do all the things that the 13-year-old is, or is it like?
Oh yeah, she's actually funny. Yes.
Okay.
She repeats when I tell her to repeat things. She doesn't do it, but when her sister tells her to repeat them, it's a whole thing. Yup.
She's like, yeah, I'll do whatever you say. I'm gonna go ahead and bring you back up. Okay. Awesome.
Thank you. Thank you.
You're very welcome. All right. So we got to learn a little bit more about Sophia, and this is the shining face you'll see when you walk into the office. All right, everybody. Have a good
Thank you.
Hey everyone, Dr. Angie here at Culkstone Chiropractic. We have Tanisha with us today, and we're going to treat whiplash. So when you have that neck injury, whether it's from headbanging too hard at a rave, or whether you were in a rear-ended car accident and your head goes back and forward, that lurching motion, a lot of times you end up with the sprain strain, but also sometimes the stiffness that comes afterwards. We have a lot of fixation and stuff that we treat with that. All right, so I'm going to have you start out on your back for me. And we're going down.
Why have I never noticed those clouds on the ceiling in here?
Never?
Never.
They're in every room.
Literally, I've been here since May. That's a problem.
Where did your whiplash come from, Tanisha?
I've been in several car accidents actually, but my most recent one, I was hit by an 18-wheeler, so.
Oh my gosh.
Yep.
That's aggressive.
Yes, so you can imagine my head was all over the place.
Yeah.
It was a lot.
I was going to say, even in the most minor of fender benders, car accidents,
Yeah.
you can still have that whiplash because it's the unexpected, that jerk motion.
Right.
And it doesn't have to be much, and it's oftentimes at the C5, C6 area where it kind of just folds over, where that apex of our curve and like where the most of the force gets taken. So typically starting out, we're going to go slow. We're going to find that stretch, just kind of feel out the movement, whether the body can tolerate. But I found the fixation down low, and then we had a spot up high here on this right side. So, and just adjusting, you can get to the point where, especially with her, like you can adjust normal. Good. Very nice and easy. We also work into the mid-back because a lot of the muscles, like your levator scapula, your upper traps, they go down into the mid-back, so we do treat the mid-back as well. Little stretch. All right, I'll bring you back up and then I'll have you flip over onto your stomach for me.
Perfect. Feel like I have a whole new neck after that.
Oh, darn. Failed. It's just all sorts of shredded there. Okay, there we go. So we're going to start low here. Breath in for me. And breathe it all out. Good. One more. There it is. Good. We're going to get a little bit into this area here. Let you just kind of rock with me. A little pressure. Good. One more. There it is. Nice. Good here. A little bit. Nice. Awesome. And then just for you, I'm going to give you the lift with the hips. So I'm going to have one hand here, work our way up. Good. Awesome. We're going to do that same thing on the other side. Good. Awesome. And bringing you back up. How are we feeling?
Great.
Phenomenal.
Yeah,
All right,
I actually feel really good.
Thanks for watching.
Thank you.
Hi everyone, Dr. Angie here at Cockstein Chiropractic, and we have Tanya here with us today. She's experiencing some neck pain. Tanya, tell me about it. What are we noticing today?
So really, it started yesterday during yoga.
Okay.
I learned I couldn't do one of the moves, and I was very like, what's a good word for it? I went to do the wheel, and my upper back was like, nah, it wasn't
That's a tough
moving.
one.
Yeah.
There's a reason why it's not like not everybody jumps into that one. But are we feeling like upper back into the shoulders, or are we feeling it more in like the top of the neck?
Upper back into the shoulders.
Okay.
I do a lot of desk work, so
Yeah.
it's a lot of this.
A lot of this. No desk shrimps. We don't want desk shrimps. Okay. Let's go ahead. I'm going to have you start out laying face down for me. We're going to check out that upper back area. I'll look into adjusting the lower for you. And going down. Maybe. There we go.
Gotta love these tables.
Yeah. What's funny is that he fixed it.
I know.
Oh yeah. So we're finding a lot of taut fibers, really tight muscles, some trigger points. Any headaches associated with the neck and shoulder pain going on?
Yes, so I started getting headaches around like 2 days ago,
Okay.
and they come and go.
Gotcha. Did you notice it was worse after yoga? Mm-hmm. All right. So a lot of times trigger points, they have a referral pattern. If they're an active trigger point, it just causes, I don't want to say random, but random pain. And a lot of times trigger points here in the upper trap can refer pain up into the neck and sometimes around into a headache. And then we'll also get tight ones right at the top of the shoulder here. So those upper trap fibers, levator scap fibers, everything around that shoulder. Let's see if we got some matching ones on this side. Yeah. Try something for me. Just look up like you're trying to look at the window in front of you. Is there pain with that? Or
No.
Just tight.
Just tight.
Okay, go ahead and relax down. All right. Good. Felt some ribs moving? We'll take it. A little bit here. Good. All right, take a breath in for me. And breathe it all out. Good. One more. Bring it over here at the head of the table. Let your head rock with me here. Good. Nice. We do the same thing on this side. I'm going to try that a different way. Sorry, Carly, it was in your way. There we go, this way. Let your head rock with me. So, good, one more. We are extra tight there. All right, I'm going to bring you on up, and I'll have you lay on your back for me.
Okay. There's something in the middle of the road.
The fun things about having windows.
I know.
Carly's like, what's out there? I mean, not gonna lie, I do that a lot when I'm working on people. I'll be like, The worst one, though, is you hear a horn honk and you hear the screeching tires.
Oh,
and I'm
yeah.
like, one day I will hear the... like, hopefully not anytime soon, but I'm waiting for it. One day it will happen. Oh, yeah. All the way up into this left side. So we're going to do a little stretch here. Let your head just rock with me. I'm going to do the pin and stretch. Oh, yeah. That was a lovely face. That's why I know I got the right spot. Good. Keep breathing. That's important. Keep breathing. All right, so you got lower on this left side. Let it rock with me. Good. Awesome. I had a patient say the other day, they were like, you like this way too much. And I'm like, well, I do it for a living. I better like it. It's a lot of fun. There it is. Nice. Little pull. I'm just going to sit and apply a little pressure to the suboccipitals here. Just keep letting your head just relax with me. All right, one more little traction here. Good. All right, and I'll bring you on up. Yep. If the table will let me. All right, and that is a cervical treatment. Does it feel slower?
Yep.
Okay. Thanks for watching, everyone.
Hey guys, it's Jayla, your Calcine Chiropractic CA. Today I have Dr. Angie.
Hi.
Dr. Angie is one of our new doctors. She's going to be jumping on the team and she's going to be jumping in and help us out.
All right, so we have Jayla here, and she was having some wrist irritation after working really tightly, fixing links in a watch band. So this position her wrist for a long period, and she's having some irritation and inflammation on this side. So we're going to go ahead and use the laser to treat that.
First and foremost, the glasses, of
get
course.
the fancy shades.
Do I look cool?
Right,
You always look cool.
Thank
So
you so
fashionable.
much.
I'm probably going to do 15. You want to do just for example purposes?
Yeah,
Let's
that's
see.
cool.
Cool.
Technical difficulties. Yeah. and then just.
I was gonna say, just again.
It's just so sensitive sometimes.
It wants to be touchy.
Yes.
Oh,
Too early.
Time I waited.
Yeah, I push it again.
Throw on the Jeopardy music.
Doom, doom.
Yeah, right? Just like fast forward through this part.
Sensitive machine here. There we go.
There you go. Now it's working.
Yes.
Yeah, I was gonna say bring the pillow a little bit more. Yeah.
So you haven't tried this head yet, Joe?
I have. I use this one on usually like TMJ or stuff like that, like on like the face and stuff. But I don't know why when Dr. Angie put it together, it looks so different. And I don't know what that was. I'm like, I've seen this before though, so I'm not sure what's happening. But yeah.
Have you personally tried that one?
I have not used this on myself. I usually use the rolly one.
The big ball one.
Yes.
Yeah, some other different lasers, they only have like one of the other two heads.
Really?
That's it. Yeah, I had never seen the one with the ball that rolled.
Oh, nice.
So I was like, oh. And the other thing was you weren't supposed to have direct contact with the skin for one of them.
Interesting.
Very interesting one. So there are a bunch of different type of lasers, but they weren't of this quality. I think that was why.
Yeah. The warmth feels amazing.
Good. And we're going to work up into the muscles here because all those muscles that extend her wrist and put her in that position attach up through this area. More so the muscle bellies are up here than they are down here at the wrist, but still where you get the tension and where we're having our pain. Let me know if it becomes too warm.
Yes, we'll do. Beautiful. Now maybe after this I can put my watch back on my left wrist because I'm looking for the time and it's on this side.
I've done that so many times.
All right. Yes, thank you.
You are welcome.
Woohoo. Okay.
We are done.
We are done.
I'll switch back the head of it so that way you guys are back to your normal.
So we're not confused when we see it. All right.
Oh, stay.
Okay, I know what we do now that's different. We take off this whole thing.
Ah.
That's what I'm like, it looks so different. So usually we take off the whole thing.
That makes sense too.
But I love how that fit. I didn't know that was gonna do that.
I wasn't sure that, I mean, I didn't realize that this whole head did come off, so we learned something new.
We both learned something. We love that. All right. Thank you guys for watching, and stay tuned for more Dr. Angie videos. This will be fun. See ya.
Bye. Hey everyone, Dr. Angie here. We got Bella. We're dealing with some back pain, more so on the left side. All right, we got some mid-back stuff going on, so we're gonna check it out. We think we might have some rib fixation going on. How long have we been feeling it?
Yesterday, this morning.
Yesterday, okay.
Yeah,
So not like
crazy.
we've been dealing with it for a week or something,
No.
but just the leaning over, bending, reaching, picking
with
up
the
a
kids.
kid. Yeah.
You know, the little finger.
Hand holding as you're walking around with them.
Spend a lot of time in this position.
We don't want to end up like that. All right, let me have you go ahead and lay face down for me.
Meow.
And you got the armrest up by your side. There you go.
Dun, 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 dun.
And you get all the beautiful, luscious locks out of the way. There's some of them already. Yeah.
Yeah, you
Right
feel
in here?
it? Yeah.
Okay. Not a ton of low back stuff going on, or just tight as usual?
Just tight. I do a lot of bending.
You do.
The whole spine is not happy.
All right, I'm gonna do a little lift with your hips here. One hand on the front, little lift and twist. One more. Good. A little bit of the rib, right? All right, we're gonna do that same thing on the other side.
I love those ones. They're so cool.
Right?
You're like the only doctor I see that does this adjustment.
I think I'm the one that kind of introduced you to him. There it is. Yeah.
I love that one.
Breath in for me here. And breathe it all out. Good. Yeah.
My neck's always got a lot going on.
Go ahead and let your head kind of rock. Flip to the side. Maybe drop it. Yeah, you got it on the other side too.
So nice and yummy.
There it is.
Whoa. That was a good one.
That was a good one. All right, I'm gonna bring you on up. I'll have you turn over. Actually, go ahead and lay on your side facing me. We're gonna get the lower back too.
Woohoo! Because why not?
Need it.
You never, no reason not to. Might as well.
Slide a little bit closer. Perfect. Breath in for me. And breathe it all out. Good. Nice. And
Such a cool low back adjustment. So cool.
You're quite crunchy.
You are crunchy.
Oh, I know.
It makes it better for videos,
I
right?
love that I'm crunchy.
Breath in. And breathe it all out. Good.
Oh,
And flat on your back.
so cool. People watching are probably like, how does she do that? I don't know.
Yeah.
It's
Magic.
all in the flick of the leg.
Oh yeah. How's that feel?
Yummy.
Yummy? Okay.
Yummy.
Does it radiate anywhere? Not getting headaches or anything?
No.
Tension there?
It hasn't moved yet.
That's good. You don't want it to move.
No. I do soft tissue like pretty regularly
Good.
throughout the night. So it moves better.
Oh, I like the pearl earring.
Oh,
that one's
thank
cute.
you.
I like all of them, but that one got
Pearl
me. I was like,
specifically.
ooh, yeah.
Stretch those traps.
Yeah. Oh yeah.
Oh yeah.
Felt that one?
I did. Nice. Art 2.0.
Right? All right. Little adjustment here. Let your head rock with me there. Good.
Yummy.
And lower on this side. Good. Extra crunchy. All right. Awesome. All right, we're gonna go for this one first.
We're doing a wraparound?
Yeah. Let me get this in the pocket.
So let's not stab you with the ring.
Yeah, I was like, no stabbing you or the table with the ring.
Table will be fine.
And breathe it all out. Tiniest bit. You
little
might have gotten a lot of
baby.
that on when you were face down. Same thing over here.
I think I'd move better face down than my ribs.
Yeah. Well, here, breath in. And breathe it all out. There it is. Nice.
That
All
was
right.
nice.
got
Thank
'em.
you.
You're very welcome.
Now I can bend and move all day.
All right. Awesome.
Nice.
Feeling a little looser?
Yes, thank you so much.
Bend down. Do you feel that pull in the rib?
No.
Wonderful.
That's awesome.
Yay.
Thank you. Oh my
welcome.
goodness.